So off we go into operatory number 3. So this is this is our third operatory, where we'll also do hair transplantation FUE procedures primarily on our day-to-day basis.
Fantastic.
So each OR has a little bit different shape and size. This is one of our smaller ORs as opposed to the teaching OR, which is a little bit larger.
Mm-hmm.
So today in treatment room 4, we're doing eyelash transplantation, and we're going to be able to step in and take a look over the shoulder of the technicians that are preparing the grafts for implantation. So now that we've got some grafts that are already dissected and prepared, with the long hair still attached, they're going to thread those grafts, those hairs, into the implantation needles. And they'll create probably a couple of dozen of those needles loaded with the grafts, so ready for me to do the implantation.
So this is quite a unique part of the process for this specifically for the eyelash hair transplant.
Yeah, this is specific to eyelash transplantation.
Yeah.
It's like no other procedure that we do here at Bauman Medical.
Yeah,
Come on, let's go take a look. So Melissa's pairing or tripling the single hair grafts together, and then she'll be threading that into the French eye needles that you see there. And this tray is specifically designed to keep the grafts exceptionally cold for many, many hours and moist.
So in terms of the duration of this, it's very similar, or I presume actually it would be a little more time involved than a standard hair transplant procedure, sort of based on from the timeline from the extraction process to the implantation process. Is there a similar kind of timeline?
Well, we're going to probably start implanting in about an hour.
Oh, okay. So
it's not an extended period of time. It's actually going to be pretty quick.
Yeah.
Because
just the intricacies of this particular part of the process. But obviously, there's only 150 per eyelash. Is that correct?
Right. So we're going to implant 3 at a time, typically, if we can, and we're going to implant roughly 90 to 100 lashes per eye.
Wow.
But it depends. You know, sometimes the anatomy allows us to do a little bit more.
Yeah.
Sometimes there's more challenges, and we just can't do as many, or we have a shorter lid to work with.
Indeed. Yeah.
But, you know, there's a lot of manpower even behind an eyelash transplant, because we've got several technicians doing dissection. After I took the strip earlier this morning, several technicians working on the dissection of the grafts, and I have several working on the preparation of the grafts in terms of implanting. And then I'll be implanting. It'll take about an hour per eye.
So very similar to a hair transplant procedure. The patients come in around, I assume, about 7:30, and should be leaving around 3-4 o'clock this afternoon.
Probably quicker than that. Probably like 2 o'clock.
Cool.
Maybe even sooner. Depends.
Yeah.
Again,
it depends.
Challenges that can occur.
You don't know what's going to unfold between now and then, but brilliant. No, interesting to know.
I want to show you some interesting things that are also in this room, because we use this room for PRP primarily, as in addition to the eyelashes and eyebrow surgery.
And this is treatment room 4, yeah?
Treatment room 4.
Yeah.
So I'm very proud of this tool. This device right here is a Beckman Coulter cell counter. So this is like a CBC machine that you would see in a large hematology clinic or in a hematology laboratory. And what this enables us to do is to take a complete blood count on a patient that we're going to do PRP on. So we'll be able to take a blood sample, get their platelet count, baseline platelet count, and then after we create the PRP, we'll be able to do that process again with a couple of microliters, just a few drops, to determine the final platelet concentration. And we're aiming for a very, very specific sweet spot on the platelet concentration, as well as monocyte concentration, which are anti-inflammatory cells and stem cell-like components within the blood. So this helps us really track that, and it's something that not too many physicians have.
So how many PRP treatments do you generally perform per month here at Bauman Medical?
Well, we spin PRP on nearly every patient.
Do you?
Yeah, for transplants for sure. And then we have probably between 2 and 4 PRP treatments per day in the clinic.
Wow.
So we're spinning quite a bit. We've done over 4,000 PRP treatments.